Bismillahirrahmanirrahim. The next topic of our discussion is type 2 hypersensitivity reaction. So type 2 hypersensitivity reaction is also known as antibody mediated hypersensitivity reaction. The antibodies involved in this reaction are either IgG antibodies or IgM antibodies. IgE antibodies are only involved in type 1 hypersensitivity reaction. The type 2 hypersensitivity reaction is caused by the antibodies that react with the antigens present on the cell surfaces or in the extracellular matrix. So antibodies could be either IgG or IgM. Antigens are either present on the cell surface or extracellular matrix. Moreover, these antigens could be either endogenous, which means they are indigenous to the body, such as alpha 3 chain of type 4 collagen in good posture syndrome. Or these antigens could be exogenous, which means they are acquired from the external environment by the body, such as some drug metabolites. So coming on to the pathogenesis, the type 2 hypersensitivity reaction could be either dependent on the complement or it could be independent of the complement. The complement dependent type 2 hypersensitivity reaction is either IgM mediated or IgG mediated. Moreover, phagocytosis also employs complement systems. The complement independent type 2 hypersensitivity reaction is also known as antibody dependent cell mediated cytotoxicity. So let's discuss the pathogenesis in detail. So in IgM mediated type 2 hypersensitivity, the antigens are present either on the cell surface or in the matrix, and IgM antibodies are formed against these antigens, forming antigen-antibody complex. So this antigen-antibody complex activates the complement system, which produces C5 to C9 complements. C5 to C9 complements are also known as membrane attack complex or MAC. So this membrane attack complex actually damages the cell membrane, resulting in cell damage. IgM mediated type 2 hypersensitivity, since it uses the activation of complement system, it is complement dependent. IgG mediated type 2 hypersensitivity reaction is also a complement dependent system, and the antigens present on the cell surface or intracellular matrix are attached by the antibodies. So these are the antigens and these are the antibodies which are attached to the antigens, hence forming antigen antibody complex. So this antigen antibody complex activates the complement system. This here is a complement system which is activated, and the activated complement system results in the production of byproducts such as C5a and C3a. So these byproducts are actually chemotactic factors and they result in the recruitment of the leukocytes. As you can see here, this is a neutrophil which is recruited by the C5a byproduct of complement system. So these neutrophils attach to the Fc part of the IgG antibodies by the Fc receptors. And this attachment results in the activation of the neutrophils, which releases certain enzymes, which includes proteases and also reactive oxygen species. So what are the reactive oxygen species? The reactive oxygen species include hydroxyl ion, hydrogen peroxide, and superoxide ion. So these proteases and reactive oxygen species result in the damage to the cell, hence causing the inflammation. The complement dependent type 2 hypersensitivity reaction also implies phagocytosis. So let's say this is a cell which is marked by the presence of antigens. IgG antibodies are attached to these antigens, forming antigen antibody complex. So antibodies attached to the cells having antigens are known as opsonized cells, and this process is known as opsonization. So opsonization is basically marking of the cell to macrophages for phagocytosis. So macrophages attach by the Fc receptors to these antibodies and ultimately result in phagocytosis and destruction of the cell. In addition to antibody coating, antigen-antibody complex also activates the complement system. This complement system results in the production of C3b and C4b byproducts. As you can see here, this is the complement system which is activated by the antigen-antibody complex, resulting in the production of C3b byproducts of the complement. Macrophages also have C3b receptors, as you can see here. So these receptors attach to C3b complement, which also results in phagocytosis and resulting in complete destruction of the cell. The examples of this type of type 2 hypersensitivity reaction include autoimmune hemolytic anemia and autoimmune thrombocytopenic purpura. So by far we have discussed the complement system dependent type 2 hypersensitivity reaction. Just to recall, this includes IgG mediated, IgM mediated and phagocytosis mediated type 2 hypersensitivity reactions. Coming on to the complement independent type 2 hypersensitivity reaction. So as the name shows, this is complement independent, which means there is no employment of the complement system or no activation of the complement system. So antigens are recognized by the IgG antibodies, which form antigen-antibody complexes. So leukocytes get attached to the Fc site of IgG antibodies by Fc receptors, and this activates the leukocytes, resulting in release of certain inflammatory mediators causing cell injury. In certain cases, the attachment of the antibodies is to the antigens, which are the cell receptors. In this case, the antibodies occupy the receptors and increase the cell function by positive feedback. So in Graves' disease, let's say this is a cuboidal epithelium of thyroid and this is TSH receptor. So IgG antibodies identify this TSH receptor as an antigen and get attached to these receptors mimicking TSH. As a result of attachment of this IgG antibody to the receptor, there is excessive secretion of thyroxine by the thyroid gland. In this case, there is no cell destruction, but there is cell dysfunction. So this mechanism is also known as antibody-dependent cellular cytotoxicity. The examples of this mechanism include Graves' disease and myasthenia gravis. So the outcome of type 2 hypersensitivity reaction is inflammation of the site of cell destruction or tissue damage, such as glomerulonephritis, resulting in nephrotic or nephritic syndrome. Apart from the inflammation, the other outcome is cell dysfunction, such as in myasthenia gravis and Graves' disease. And cell destruction ultimately results in complete loss of the cells, such as in hemolytic anemia. The examples of type 2 hypersensitivity reaction include autoimmune hemolytic anemia, autoimmune thrombocytopenic purpura, Goodpasture syndrome, which damages the lungs as well as the glomeruli in the kidney. Other examples also include myasthenia gravis and Graves' disease. The treatment of type 2 hypersensitivity reaction is with the steroids and immunosuppression therapy, since type 2 hypersensitivity reaction is due to dysfunctioning immune system. So this concludes our section about type 2 hypersensitivity reaction. If you have any questions, do let us know in the comment section. Thank you.